UNICEF has received a grant from the European Union's humanitarian aid to help roll out COVID-19 vaccination. Vaccines will be distributed to 12 countries in Eastern, Southern, West and Central Africa. Now, many children have been hard hit by the pandemic, some forced into child labor or marriages, while millions fell into extreme poverty. Joining me from Nairobi, Kenya is UNICEF Eastern and Southern Africa Regional Advisor, Gabriel Fontana. Gabriel, very good evening. Thank you so much for joining us here on eNCA. So tell us, this funding that you've received, what is it going to help you achieve? Where are you best placed to put this funding?
Thank you for having me. You see, this is part of 100 million euros that the European Commission has made available to support COVID vaccination in the continent. And 16 million of those are channeled through UNICEF, but other funds are going to other agencies like WHO, WFP, international NGOs, and the Red Cross. And so it's a joint effort under the coordination of the Africa CDC to strengthen the immunization for COVID in the whole continent. The funds through UNICEF are channeled to support those 12 countries, and the idea is to strengthen the capacity of governments to reach the high priority groups, the elderly, people with health conditions, health professionals that need the vaccine the most because they're the most at risk of dying from COVID. Once we do that, we also want to expand the vaccination to as many people as possible to prevent the emergence of additional variants that we have seen are so threatening to end the pandemic.
We've looked at some of the issues or the challenges in Africa when it comes to the COVID-19 vaccine. I mean, some countries have got weak supply chains, the infrastructure is not so good, even looking at the cold chain infrastructure that's required for some of these vaccines. So it's not just a matter of supplying the actual vaccine, is it?
No, it's not. You're right. The challenge is to get the vaccine in the arms of people. And as you might know, UNICEF is well positioned to support the cold chain because on a routine basis, year in and year out, we support vaccination of children throughout the continent. So it's not only about the procurement of vaccines, it's also about, as you rightly said, the cold chain, making sure the vaccine are effective and they get to the last mile. It's also about mobilizing communities and supporting the coordination of the immunization services that need now to absorb and deliver millions of doses, which is an unprecedented challenge.
Well, look, I mean, the African Vaccine Acquisition Trust came out saying countries need predictable and reliable supply for them to plan and also maybe, I suppose, deal with that infrastructure deficit. Why are they saying that? Have we been seeing a deficit in supply in Africa?
Well, we are now at around between 8 and 9% of the population in Africa fully vaccinated. When you compare it with other parts of the globe, we're lagging behind. And in good part, this is because vaccines were not made available as early as in other continents. So it takes everybody. We have COVAX as an initiative, we have AVAT, we have all the agencies and the African Union trying to make as many vaccines available as possible and as quickly as possible. We are seeing an increasing number of vaccines exponentially in the last few months, and we hope to be able to increase the numbers even further at the beginning of next year.
As UNICEF, are you seeing hesitancy in terms of communities maybe hesitant to take their vaccine itself?
Well, so far in the continent, because of the lack of vaccines, we had more people willing to be vaccinated than the vaccines available. But we have seen how when more vaccines become available, hesitancy might become an issue to reach everybody and get to herd immunity. So through community mobilization and by addressing some of the misinformation that sometimes spreads in social media and among people, we try to well inform people of the fact that vaccines are safe, they're effective, they prevent severe illness and death, and is a good idea to get them as soon as possible.
In your statement, you particularly mentioned children, saying children have been especially hard hit. Just explain that to us.
Yes, you see, because we know that mainly people affected by COVID are the elderly, people with health conditions. Sometimes we forget how children have been affected. All the containment measures that were necessary to stop the pandemic or to delay the pandemic and to be able to vaccinate people have been very hard on children. When you think of just the closure of schools that has happened in almost every country in the continent, many children get their main meal at school, and the school is a safe place for them to learn. And once they found themselves alone at home in households that have been strained by increased poverty, lack of resources, they could not access essential services. All of that has taken a huge toll on children. And I'm afraid that it will take years to correct that. 1 year of lost schooling, it takes 2, 3, 4 or more years to recuperate. We have seen in previous pandemics or outbreaks with Ebola in West Africa a few years ago how children that drop out of school because schools are closed might never get back there. So we're really working hard with governments to try and mitigate all of that.
You just mentioned that previous pandemics, and you were talking about the polio vaccine. I mean, back in those days, there was a lot of door-to-door engagement, wasn't there? Do you see any of that happening on the continent?
More and more. I think everybody is grappling with the challenge of vaccinating so many people in such a short amount of time. So now different strategies are being put in place by governments. We're increasing the number of vaccination sites, but also mobile activities, door-to-door campaigns are becoming the core strategy for most governments now to reach people where they are. Sometimes it's difficult for people to reach health facilities, and so governments are now trying to go where they are. At churches during the weekend or mosques on Fridays, in schools, in sports events or public events, to try and reach people with the vaccines and make vaccination easier for people. More and more we're seeing that, and this is a successful way to achieve immunization of the population.
All right, thank you so much, Gabriel Fontana. They're talking to us from Kenya. He is with UNICEF Eastern and Southern Africa Regional Advisor for UNICEF, talking about the fresh funding to support COVID-19 vaccination in sub-Saharan Africa they've just received.